Well, it's not luck. It's the choice. It's the choice, and it's the result of the proper planning and strategy. Because
today, we're joined by Dr. Nazariy Mykhaylyuk, a world-renowned dentist, educator, and pioneer in digital and microscopic dentistry. He's the founder of M-Vision Academy, where he trains dentists globally in precision-based, restorative, and aesthetic workflows.
What most human beings would not be able to sustain and take the pressure of what you've gone through with your home country, at war, and your clinic in a position that is really right in the war zone.
One thing I learned that is very important is self-control, because if you lose control, that's the worst thing. If we can run a successful clinic in Ukraine, probably we know something.
Why do you think technology now allow us to do things different level?
Nowadays, we can combine facial scan of the patient, teeth scan, we can record all the movements of the mandible, create a digital avatar of the patient, and it's not something from the future, it's already something that is really present.
Any advice that you would like to give to the younger dentist?
All the success we see, there is a big price they pay. Price like your time, sometimes your private life, and very hard work.
Do you think AI will play a big part in what we do coming the next 5-10 years?
I think we...
A very warm welcome again, and thank you, Dr. Nazariy. Finally, I get to speak to you on our dental podcast, which is Dental Optimist, and why I wanted, you were asking me, why are you doing this? What's the purpose of doing dental, another podcast? And the real reason is we still want to inspire the next generation, and of course, to give hope to our patients as well, that there is quality and there is good people around that are willing to share, willing to teach. And you were one very special one. I met you in 2018, if I'm not wrong, at that time when you first came to Malaysia, and we invited you because it was you were so special. One of our associate dentists attended your course in Ukraine and was totally and utterly impressed by you. And I was going, who is this young guy? And I just wanted to share this story before I even ask you any questions. There are not many people throughout my whole career of meeting dentists that when you meet the person, you know that they are special. And you were absolutely one of them, because you were so young at that time. You knew exactly what to do. You knew exactly what dentistry was all about. And the energy and the level of inspiration and wanting to teach and wanting to share what you've done was just amazing. So I just want everybody to realize that you've got a very, very special guest today. So please listen on, and I hope we are able to let Dr. Nazariy share as much as he can. So for those who do not really know you, I just want you to give a brief description of what you do nowadays and how you've gotten here. Yeah.
First of all, Dr. Jeanette, thank you so much for the invitation. It's my pleasure to be here. And, what you're doing in dentistry in Malaysia is phenomenal. So I'm super happy to be able to cooperate and also to be friends with you.
Yes.
Speaking about myself, as you know, I have a clinic, I have a lab, and 2 training centers, one in Kuala Lumpur, another one in Las Vegas. And the main focus are full mouth reconstructions and smile makeovers, because this is what I was always dreaming about to do. And this is where my strategy brought me. Because quite often I'm sharing the clinical cases and people are saying, wow, we have so many full mouth reconstructions, smile makeovers, and we have to do single units. Well, it's not luck. It's the choice. It's the choice, and it's the result of the proper planning and strategy, because dentistry and successful dentistry is not only about going to work every morning and going home every evening. It's about understanding where you see yourself in 5 years, 10 years, and 15 years. Because it's like when you're, changing the interior design in your home. I mean, unless you know what is your final plan, only then you know how to come to that result. The same thing is with your both personal life and professional life. If you do not know where you see yourself in the future, how can you create for yourself a plan and strategy? And this is why more than 15 years ago, I would say starting from 2008, I was trying to put my own plan together because I understood that I don't want to do just single units, just fillings, just one tooth endodontics. I wanted to make big changes and help people to improve their health and their smile. And as a result, now I would say more than 80% of the work that I'm doing are full mouth rehabs, and around 20 are smile makeovers. So combination of orthodontic treatment and ceramic veneers.
Yeah. Right. So for people that don't quite understand, dentistry obviously have different fields, but when I first met him, I was so inspired. And even though I'm just doing perio, I just do surgery, one small part of dentistry, I realized that the whole picture needs to come together, and you brought that into light. And that's how you have also shaped me over the last, nearly 10 years now. So it's been quite amazing. So you were right about having a plan. And I think having that plan is, a lot of the young ones don't necessarily do that for themselves in terms of their personal life, and even for patients as well. So I would like you to just explain a little bit, how did you even see it? What inspired you to see it? Because I know you're super, super smart because there must have been a light bulb moment that you decided, hey, I've got a plan, Yeah.
Well, probably I didn't know everything those days. Some stuff was intuitive, but what I understood that when I read the books of the famous people like Mauro Fradani or like Domenico Mascheroni or the others, I understood one thing. That was the day when they graduated the university. And they were not famous.
Yes.
They were just like all the other students who graduated that same day.
That's true.
So that's the starting point. Like, when the runners are running, there is one starting point where everybody is in the same spot. But then years after, there is already the difference between the position of these runners. The same is about dentistry. So depending how you build your strategy through the years and how hard you work to make the strategy happen, that will differentiate you in the long term from the others. So in 5 years, little difference, 10 years, even bigger difference, 20 years, even bigger difference. And it's not luck.
Yeah.
Again, it's a plan and hard work.
Yeah. No, I like the fact that you say it's not luck. And I mean, being friends, I've seen you gone through really what most human beings would not be able to sustain and take the pressure of what you've gone through with your home country at war and your clinic, in a position that is really right in the war zone. And you have still done so well and worked through it through all these years. A lot of people don't realize that we make choices, and some people get it so hard. And I've seen you gone through so difficult. I just want people to realize you don't know that a lot of people just think that people are successful, like how you appear to be so cool and calm on social media with one of the highest following numbers, in our industry. But people don't realize what you go through behind. And I don't know, I would love for you to share a little bit of what happened and how you have to make critical choices and still be able to make the clinic work and patients to come and pay this amount to do full mouth rehab, because there's a reason for it, not just to do patchwork, dentistry, I think. Yeah.
Well, first of all, one thing I learned that is very important is self-control. It doesn't matter what happens in your life, because if you lose control, that's the worst thing.
Yeah.
The next thing is that human beings, we are very strong as human beings, and we are just shocked that we can adjust to everything. And we even adjusted to those conditions that we have nowadays in our country. And now I can tell you that if we can run a successful clinic in Ukraine, probably we know something.
Yeah.
Because otherwise it just wouldn't work.
Yes.
And also what's important, it's important to know how to explain and how to create value of what you're doing. Because it's a pity, but a big part of the market is competing who's going to put the lower price.
Yes.
Instead of creating the value. So we have to remember one thing. The most difficult part is to work in the middle zone and the low-level dentistry. Why? Because everybody's there.
Yeah.
And that's why competition is huge. And instead of raising the quality, and possibly the price, people are lowering the price. So in hope that the patient is going to come to their office to do a case. And then, of course, these people are coming to your lecture or to my lecture or somebody else lecture. They see this technology, these new implants, I don't know, jaw tracking systems. And then they hear how much it costs and they are like shocked because they're not making so much money.
Yes.
Because it's a closed circle. Like the proper dentistry and successful dentistry, it's a closed circle.
Yeah.
Because to be able to do proper dentistry, you have to be able to generate income.
Yes. Yes.
And quite often, doctors, I don't know, they are either afraid to speak about it, but I don't know any doctor who's working for free, right?
Yeah, no.
Everybody is working for the profit.
Yes.
And that's why it's important to make a profit, because if doctor is capable of making profit, doctor wins and the patient wins.
Yeah.
Because doctor is able, to invest in his knowledge. Doctor is able to invest in the technology.
Yeah.
And because otherwise doctor is limited.
Yeah.
Whatever he or she learned in university, and on that level they stay.
Yeah. Yeah.
And this is why, again, coming back again to your question, it all depends on your goal, because you either look for chances in life or you're looking for excuses.
That's true. That's true. I learned that a lot from you actually over the years, because it is very hard actually to communicate to patients sometimes, and really even to the young ones, quality actually needs to be there. And in order to have good quality, you still need good equipment, you need good training. If not, you're not going to get there as well, because when we graduate, as you say, we come out all at the same line. But why do we end up being different, right? So that's so inspiring. Now, with all that's going on now with dentistry, let's get back to what you do, which is full mouth rehab. Why do you think full mouth rehab is so confusing to so many dentists? And everybody just thinks that it's, okay, I just cut the crowns and it's just, cut the teeth and put it on. And why do you think technology now allow us to do things, which is why we brought you here to Kuala Lumpur, because I saw that you were doing things at a completely different level and looking through microscopes, checking everything, single thing in detail, having the patience to know that quality means spending the time doing the right thing, plus doing the diagnosis using the latest technology. What brought you there, and why do you think this is so important looking to the future? And this is not, I think this applies to what we were talking about, unified dentistry, and why we need to move one step ahead. Yeah.
Completely agree with you that full mouth reconstructions are not only about putting the crowns or veneers or onlays. It's you have to have way more knowledge rather than to change old restoration to the new restoration. You must have a lot of knowledge about occlusion, about TMJ, how to deprogram the patient, how to work with the muscles. Because when you're watching somebody who is already knowledgeable, doesn't matter if it's prosthetics or surgery, looks very simple.
Yes.
Looks very simple until the moment you try it.
That's true.
And then you realize that probably there are so many processes happening in the head of that specific specialist. And it looks so simple just because, you know how they say that the professional failed more times than the young dentist tried.
Yeah, that's true.
And that's why when you have that database in your head of all these failures, when you're doing any procedure, you already automatically eliminating these failures that already happened before. And especially when you speak about the full mouth reconstruction, one thing, if you fail with one tooth, and maximum that can happen, okay, you lose the tooth. Yeah. But when you fail with the 28, that's a way bigger problem. I mean, so that's why I'm always saying, if you do not have that knowledge, do not start doing any full mouth reconstructions, because you can get yourself and your patient in trouble, and then you will regret that you started it.
Yes.
The good news is that comparing to the old school, like back in the days, how we did the full mouth reconstructions, we had way less control. So we couldn't control where exactly is the condyle. We didn't have a very good communication with the lab. So basically our lab technicians, they were looking at our articulator when they were doing a case for a patient. So every patient for them looked the same, articulator, and nothing else.
And they don't see the face, they don't see the smile, they just look at a set of teeth or models.
And that's why the stupid mistakes happen, like, the can't, not proper occlusion, not comfortable. And nowadays, the good news are we have a lot of new technology that helps us to simplify the process and to have full control of the process. Because nowadays we can combine facial scan of the patient, teeth scan, we can record all the movements of the mandible and basically create the avatar, digital avatar of the patient. And it's not something from the future, as many people are saying. It's already something that is really very, very present nowadays. And we just have to use it. It's like, when there are cars all around and you're just walking all the time instead of using the car and simplifying your life. So the same thing is about the technology. The only thing that we have to realize, whenever we get something new, we need to invest in technology first. But then we need to learn how to use it. Because what's going to happen if you invest in technology, but you don't learn how to use it properly, you try it, you fail, and then you say it doesn't work.
Yeah, and that's not true.
And that's not true. Yes, because 10 years we're in digital dentistry and things work, and we do plenty of cases with a pure digital workflow. So this is why, again, we have to remember that we cannot stop the progress. What we can do, we can keep up with the progress.
That's true.
Like with the phones, nobody's using the phones with the buttons anymore, right?
Yeah, that's true. We don't even use phones with a button. But it is quite scary, Ben. What you have given an analogy is so true. I think part of the reason why we run this podcast is to let people realize dentistry has changed. There is no way you can continue walking out with your legs. You actually can get on the car and just go. And you move much faster, which is what you've described. People are still trying to walk with their legs, and that's not going to work. And I think a lot of people don't realize it. A lot of dentists don't realize it. And as you said, we buy and then we invest even in our own clinic with the mod jaw. It's been sitting there and they try, they fail, and then it goes, it's too difficult to use. That's the problem, I think, with what we have. Now, other than gaining the experience, one of the best thing that you have done is you came out very, very quickly and started running an education course to teach others. What makes you do that? Because that is altruistic. And to be able to think that you need to help train others, that's at another level. And your training courses are one of the best. We've done enough training courses with Ancora for a long time. We know who are the real ones and who are not the real ones. And it takes us sometimes a while to get to know. And your course is really one that really teaches from A to Z. And I love it when I have this sparring sessions with you, when you tell me, hey, it's not possible to cut it down. All right. And I want you to share that. Why? Yeah.
Well, first of all, the story, how I started teaching, it's quite a long story. I started teaching 15 years ago in 2010. It's basically when I only graduated, and I started teaching not because I thought I'm very smart to teach others. I started teaching because I started receiving the calls from the dentists who said that they saw my cases and they would like to come and see how I do it in my office.
Amazing. Yeah.
So first I was even shocked because, back in the days, 2010, I was super young and I said, what can I teach you? I'm learning myself. They just told me, we don't care how old you are, we just like your cases, please just show us how you work. And this is how it all started from those days.
That's the testament of through being good, not just lecturing and talking, and it's the real stuff that's good.
Yeah, thank you. And what I can say that nowadays, comparing to, for example, 2015, when I was doing my first steps with digital workflow, I would be happy to go somewhere to pay money. Basically, I would like to buy my time.
Yes.
And I would like to receive from somebody the recipe how to use this technology.
That's true. That's true.
But there was no one to go to.
Yeah, in those days, there was you want to learn and you don't know where to go to.
Correct. And in those moments, you were supposed to be the one who actually creates the workflow by yourself, by making a lot of mistakes. So, several months, I was doing teeth for the typodont, not for real people. Because I could see that it just doesn't look good. We had to make a lot of mistakes before we started producing good quality with this new technology. Because definitely every single time when you buy new technology, first your quality goes slightly down because you don't have enough knowledge. That's not a secret.
Yes.
But then once you gain the knowledge, you're going back to the
Up.
quality or even higher. And then you start enjoying your investment.
Yes.
And, especially nowadays, when you go to one course
Yes.
and then you do 2 cases maximum and you pay your course back, I mean, that's, excuse me, but that's coins.
Yes.
That's because you get a knowledge and then you can use that knowledge to produce many cases in the future through the years.
No, but I think our young generation nowadays would like to just attend a 1-day, 2-day course and then that's it, I'm good enough, go back and try it out myself. And the cheaper it is for the course, the better it is. And I don't know where it has gone to now. We were just having this discussion.
It's interesting, but everybody's buying an iPhone.
Yes, true.
Nobody's buying cheap phones, right?
Yes. But I don't know why we still have this mindset in dentistry that they think it's different.
I mean, everybody has a choice.
Yeah.
And for somebody, maybe this looks better than visiting, more professional courses. So, I mean, I'm not judging those people. It's their choice. But again, the question is, what is the goal? What is their goal? Where do they want to be after 10 years comparing to the others who graduated with them?
Yes.
So if they just want to go and hang out, just have a good time, you can just go to the bar.
Yeah.
I mean, they don't need to go to the course.
But
true. When we speak about the knowledge, then what I did, I can just speak about myself back in the days. I honestly, I wasn't going to many courses. I was not. I went to several ones that were really good. To be honest, they were expensive. And I was sitting there, and I was trying not to miss even a minute of what speaker was saying.
Yes.
Because that was expensive for me. But I'm glad I was there because that was for me the base and my start doing what I'm doing right now, like full mouth reconstructions.
Yeah.
Because you cannot learn things like occlusion, in just a short session.
No.
Because it's such a broad topic.
And it's such a huge topic and it's such a debatable topic. And I think dentistry is one that we actually have a very wide view and it takes all of us some time. And if you follow the right mentor, which I think it's extremely important, then you will get somewhere a lot quicker rather than going the wrong road.
That's for sure.
Yes, that's the long road. Right. You come from a family of dentists and your father is your dental technician who is world famous as well. And your sister is also a dentist. So how do you, at home, just for fun, what do you do?
I think we have every day a podcast because the topics are very similar. So that's what our family is talking about, just without microphones.
Without microphones.
Without microphones.
Yeah, constantly talking about dentistry.
Yeah, I mean, because, the major part of our life is dentistry. So eventually, whatever you start talking about, you end up
in dentistry.
Speaking about dentistry. So yeah, I'm super lucky that my father is a dental technician and definitely he influenced a lot what I'm doing right now because seeing him working so hard just convinced me without the words that I have to continue. Because I remember what I was thinking. If I had a son and I was working so hard being a dental technician, I would be happy if my son continued my work.
Yeah.
And
I've got to send this recording to your father.
Yeah, I mean that's true. I mean, my parents never made me become a dentist. I mean, I just knew it somehow automatically, So of course, and until now, I still work with him. I cooperate with him, and for me, it's a big pleasure and honor. And for some people, it's very difficult and tough to cooperate with the parents. But I mean, thank God we managed to have a very good understanding. So I'm feeling blessed.
Yeah. You're super blessed, actually. Yeah, despite everything. And congratulations as well. Your son, Maxim, how old is he now?
He's 1 year, 4 months.
Oh my God.
He doesn't know yet, future dentist. No, I'm kidding. I'm kidding. He will choose whatever
I will
he
make
likes.
sure this recording goes to him. Your daddy wants you to be a dentist.
We'll see how the dentistry is going to look like in 20 years, 30 years.
That's true. It might change.
Things are changing dramatically.
Where do you think that will go, actually? Dentistry, that was one of the questions that I want to ask.
There'll be, I think, a lot of automation. And I think like this, that this automation and the progress will make strong dentists stronger and weak dentists will just stay weak if they don't use it properly. That's the point. It's like nowadays, like we have all this technology, we have all this knowledge, but big percentage of specialists, they prefer to use the old school. They're like, okay, anyways, I'm comfortable with what I was doing so many years. And I completely understand that, because whatever new comes to the market, it's always, first it's scary because you never used it. Then eventually you say, okay, it looks fine. And then only after you start using it. And every human being reacts like this. The only thing and advice would be, don't wait too long. Because the progress now is very fast.
Yeah, it is.
So if you wait too long, you will start using one thing, it will be already old. And plus nowadays with the social media, with all the patients having, the phones and in Instagram, they see all this technology. They will just come and ask you, why you take an impression and not scanning me?
I always remember you telling me that your sister doesn't even take an impression at all from dental school up to now. They don't just no impressions.
She never tried. I mean, the same thing, microscope, like she never worked without microscope. So it's like if I tell you, work without a handpiece.
Yeah, you can't.
I mean, if you always did this, for you it's difficult to imagine how it's possible. The same thing for them, for the new generation. I mean, for them, using magnification and new technology. You were asking about my son. My son already is doing like this on the phone. He's 1 year old.
Yeah. It's so natural for them. Yeah. And it's going to be such a different world with dentistry moving forwards. And I think that's what attracted us to you, actually, because we didn't have a lot of technology in this part of the world. And when I saw your course and I saw how you did things, you were really one of the forefront, especially in private practice, because it used to be, certain people gets it, but you brought it and did it in the private practice and did it so well and was able to redesign and explain the digital workflow and put many of these important things into full mouth rehab. And I just want to highlight one thing. I know a lot of people are used to doing patchwork dentistry, or what we call fix the problem when there's a problem. But I think nowadays with digitalization, we can see so much more. That how did you even end up cracking that one tooth? Because we place a lot of implants. And it was all these years that I realized we really have to look into why the first tooth failed in the first place and why we ended up with an implant. And when we start looking at these cases, we realize in actual fact, many of them need a full mouth planning. Because if not, that tooth would not have failed first. It's not because of that tooth failing. It's actually the whole system. Do you think you can explain a little bit with the digitalization now, how you even see it more clearly? Because previously, like you see on a model. Yeah.
Well, first of all, to see things, you have to have knowledge.
Yeah.
Because you cannot see what you don't know.
Yeah, that's true.
It's like, there is this saying that's like the minimum amount of problems, you usually have the dentists who know the least. Because you have to know you have a problem.
Yeah.
But if you don't see that and you don't know that's a problem, you think that's right. That is correct. And usually a lot of problems have people who are very good in dentistry.
Yeah.
Because if you ask them, please show me your best case, they will show you some case, but they will tell you, but still today I would maybe do things slightly differently.
It's not good enough. Right?
Yeah, like this is the way. This is the way. And what we're trying to do, we're trying to look at each patient systematically. Even if the person comes to the office and says, I don't like this tooth, I want one tooth. We say, listen, I do for you a consulting. And consulting is basically, I'm providing you information about the health condition. And then after the consulting, you can do whatever you want. You can still fix one tooth, but then you know the consequences, or you can do the correct way and do it all right. Because what usually happens, why dentists treat some of the patients like forever? Because, first I treat the upper molar according to the lower one that doesn't have a correct shape. And then I need to make the lower one, but now I need to adjust it to the upper one that also doesn't have a correct shape. Then another one, And treating patients forever, in the end, there is no correct occlusion because, everything was adapted and adjusted to antagonist that is not right. And in the end of the day, then we end up telling to the patient, you know what? I think it's better to make a full mouth reconstruction. And then the patient asks you, but why did we do all those teeth?
Mm-hmm.
And you're like, because you asked.
Yes.
And patient is like, but you didn't offer me other option.
Yeah.
So this is what I'm always telling to the dentist. It doesn't matter what patients are asking you. You as a dentist, you always have to offer the right way.
Yeah.
And then the patient, who is a grown-up, takes the decision as a grown-up because he's responsible for his health.
Yes. No, I think very, very critical what you've just said just now. I so want to repeat that it is, I personally have made those mistakes, right? Because in those days, we just don't have the technology, and we are trained, especially in dentistry, as you know, we are trained in silo in our specialties. So we see things only in that aspect and say, okay, it's okay. The rest of it is not my problem. Send it off to the next person, or that's your specialty. But unfortunately, I don't think dentistry can continue practicing this way, and neither I think this our education system, and we do need to fix the whole house. You can't just fix one part of the house and it says that is okay when the whole thing is collapsing. I think that's...
And why we need the technology, because the first goal to have the technology is to reduce our problems.
Yes.
Because everybody has failures. I have failures, you have failures, everybody has failures. But when we have the proper technology and the knowledge how to use it, we reduce the amount of these failures. And this is the main goal.
Yes. And it's so exciting because this is now possible for the younger ones. That's why we are trying to encourage the younger ones, and also for public to realize that there's a huge difference, because if they walk into the clinic, there's not much of technology compared to one with technology. But also you have to see the background. You know, some people have the technology and they don't use it properly. That's also the other extreme. You know, that's
use it as a furniture.
They use it as a furniture or as a marketing tool. That's basically it. You know,
I have it.
Yeah,
I posted it on Instagram.
Yeah.
Check.
Yeah, that's
Done.
it. Yeah, but they don't even use it on the patient properly because they don't, as you said, the knowledge. Yeah, the knowledge. And
that's the problem. That's the problem of the present social media. Very difficult to draw the line between the truth and fakes.
Yes.
That's the point.
Yeah.
I mean, it's difficult both for patients and also for
dentists.
dentists.
Yeah.
For everybody.
Yeah. Do you think this will improve? Because part of the reason why we did this is because I just want to cut through the noise and, you know, like, can we have something that is true, that people are willing to speak the truth? Because sometimes on social media, you don't want to attack and you don't want to, you know, like bring out the things that are not good. But
what we're doing right now with this podcast, I would compare to the consulting with the patients.
Yeah.
The patients are looking at us, patients, our colleagues, and they can choose to do one tooth or to do the full mouth reconstruction. They are grown-ups and they are choosing their professional path. They can either become the best or they can be happy with what they have. Again, it's their choice on.
Yeah, that's true. That's true. But I think it's still our duty to speak out as much as we can. Yeah.
That's what we're doing.
Yeah, that's what we're doing. All right. Any advice that you would like to give to the younger dentist, right? And how, when they feel that, you know, we've nowadays we've got young ones that tell us, you know, they're working too hard and it's too tiring. There's no time for training courses and I don't have the money for it because I've got to spend it on holidays and everything else. How do you even balance that, you know? And you being young, I've seen how you've grown, you know, from nothing to something and to on top of the world and having the most difficult conditions to work with your clinic in the war zone and you not being able to even get to your clinic. I mean, you must share your story because you brought tears in my eyes. I remember when I called you, I saw you in Las Vegas. I was so thankful that you were out of the war zone. And I said, Dr. Nazariy, if there's anything I can help, I would, you know, because you are somebody special that has done so much for our industry. And I think you need to share why to these young people, what you go through every day is far more difficult compared to a lot of people. And the young ones need to realize that, I think.
Well, speaking about the young dentists, you know, recently I was on one of the courses and there was one young guy. He was 25 and he told me, Dr. Nazariy, what do you think about my plan? I want to move to Hawaii and surf over there. And when I have some time, I want to do dentistry. And I'm like, amazing plan, man. Amazing plan. But I don't know where this approach is going to bring you. Probably you'll become a good surfer. I'm not sure about a good dentist, because all the success that we see from the people who gain something in life, there is a big price they paid.
Yes.
And it's a fact. It's price like your time, sometimes your private life, and very hard work.
Yes.
Because otherwise, if those people were working as hard as the others, they will be in the position as the others.
Yeah,
and they would be running on the same level as the others, not ahead. So then we have to ask ourselves, what is success for us? Because definition of success for every person is different, right?
Yes.
So maybe somebody feels successful doing 1 crown, and that's also completely fine.
Yeah.
But if somebody wants to do more than 1 crown, but wants to really change people, make big cases, to be unlimited with the resources that they can use for a case, and that was my dream back in the days, and thank God the dream came true, then it's a completely different story. That you have to be ready to work much more. You have to be ready to learn much more. And then, of course, you will be on a different level. But again, everything starts from that young dentist. There is one thing, I'm jealous to the young people. You know why? Because they have more time.
You are still young, by the way.
I'm still young, but they're
very young.
They're younger than me. And I'm jealous because they have a lot of years ahead of them.
Yes.
And what they have to do right now is to decide how they are going to use that time.
And it's so much easier for them compared to
nowadays. Yes.
Yeah, what we had to do, we had to spend 10 times the amount of time to get to where it is, because there was no digital technology to be able to help you.
Correct. And there was no place to learn this.
Yes.
But now you have A, technology, and B, you have a chance to learn this. And basically you save your time. You don't need to go to 25 courses, each one 2 days.
Yes.
You can go to the bigger course and learn everything from A to Z, of course, if you're willing to learn.
Yeah.
This is the point.
Yeah. And I think because the associate that I was telling you, one of my partners who attended your course, he has practiced dentistry and done good dentistry for the last 30 years. After attending your course, his perspective changed and he worked under magnification, and that was my dream day came true, because we needed somebody who really focused on quality and detail, and he started doing that, and it just changed how we treated patients as well, because for surgery we work under magnifications, but for pros and to really deliver good work you need to as well, to do it right. And I think your course is one of the rare ones in the world, and I can't emphasize this enough, not because I want all of you to attend Dr. Nazariy's course, but because really, truly not one has A to Z telling you in real detail, in real life, what happens.
Yeah. When I was putting the course together, I had only one idea in my mind. I said to myself, I want to create the program that I would teach to my potential employees or partners.
Yeah.
Because when you have this type of perspective, the way how you teach people is completely different than when you're just doing a course.
Yeah.
Because then that you're preparing the person for your clinic.
That's true.
That actually is under your name.
That's right.
And if you teach him or her in a bad way, they're gonna screw up the case and my name will be hurt.
Yeah.
And this is why I put this course together. Again, just like those people who are in the room are going to be my employees. And I want to teach them so I'm relaxed afterwards what they're going to be doing in the office. And this is very important point.
Yes.
Because then do not just teach according to the book. You teach according to the book and life. Because there are many things that in the book it says do this way, but in life it's better maybe to do it slightly different way.
Thank you. Because the books do not give you the answers very, very often. And that's why continuing education in our profession is actually necessary. Yeah.
Sure.
If the books can do it all, we don't need to do this anymore. Yeah. Good. All right. Everyone is selling Smile Transformation now. obviously. And you have done an amazing job in terms of smile transformation, form of reconstruction, and how you position. In the eyes of patients and in the eyes of dentists, how do you, discern, and there's a lot of misconception on the social media. How is it easy for dentists as well as patient to identify which one is good, which one's not good? What's the real difference?
It's not easy.
Okay. Which is
One is, it's not easy because for dentists, just like for a patient, they need to have knowledge to differentiate. I'll give you one very short example. Once, a few years ago, one of the dentists published the before and after picture.
Mm-hmm.
And on the after picture, she just cut the teeth from a different mouth and pasted it. And she did it like super low level that you could see that inside of the mouth already the buccal corridor start. And after the buccal corridor, there's another premolar.
Oh my goodness.
And I was shocked. I was like, is it a joke? But then I followed the comments. I went into the comments and she's got a lot of compliments from the dentists.
Serious?
Who were saying amazing job was done.
But and
I was shocked because on one side, sometimes we are wondering how come the patient doesn't realize that this case is better done than this one, or maybe it's done with the magnification, or better there was a higher level surgeon involved, right? How can we be shocked from the patients if we see that in a case like this one, the dentist couldn't identify that it was completely edited picture. So that's why I don't have a very easy answer about your question. So, I mean, you have to pay attention. You have to go to the congresses. You have to see what people really do. I always like to pay attention. I'll give you my tip that I always follow. I don't look on the pictures. I always look on the videos. Because even it's not about before and after. It's about the approach with how person is working. Because like I can identify right away, let's say, if the person is a good restorative dentist or prosthodontist just by seeing some steps, some clinical steps in the videos.
Whether it's missing or it's not.
Then you can see if the person is working precisely, the attitude to the details, how they put the rubber dam. All these details, they create the perfectionist prosthodontist. Because just show before and after, I mean, like, who knows if that picture was edited or not, just like this one that I told you about. But again, when you see the approach in the video, this is, for me, right away shows who is maybe at top level and who is maybe still on his way.
That's true. Yeah, that's true. No, but that's a very, very good tip. And I hope a lot of people listen to this, because that's one of the main issues that we're having now with social media and people getting misconception as well. All right. I just want to highlight one thing. Is dentistry now just methodology or techniques? Do you still need to go back to diagnosis, treatment planning, or multidisciplinary? How do you deal with your colleagues or your associates? How do you teach that? Like, how do you work together with the team that you have?
The topic, the treatment planning, is always a very important topic on the congresses, different events. People can speak a week about it. And people are saying, okay, we're gathering 25 dentists together and we have like a mini parliament and we vote what we're going to do to this patient. And what we did in our office, I created this system and we're going to publish about it in the QDT 2026.
Congratulations.
Thank you. I called it M-Vision 5 Steps. And this system is about the fact that, in my beliefs, each patient needs maximum 5 steps of a treatment. First step, always, it's a perio treatment, either conservative perio or professional hygiene. Second step, it's endo-restorative, if needed, endodontics, if needed, restorative work. Third step, if needed, orthodontic treatment. Fourth step, if needed, surgical treatment. And fifth step, as it's finished, it's a prosthetic treatment. So then you just take this formula of these 5 steps and you just say, okay, for this patient, this one needs all 5. Another one, no, doesn't need ortho and doesn't need surgery. So only 3 steps or 4 steps or 2 steps. And then when you use this prism for the treatment planning, it's very straightforward and understandable.
Yeah. Yeah. And I think there's just too many formulas out there and everybody's trying to teach everything. But in actual fact, you've just simplified it. Thanks for giving us the 5 steps, giving us the answer to it. All right. Now, coming back to a little bit of public advocacy. I know you've just flown 30 over hours and getting tired, and I can have conversations with you for like 2-3 hours at one go. But coming back to a bit of public advocacy, let's talk to the patients. And how can patients differentiate quality? Can they or they can't?
Are we speaking now about the conversation or just visually?
Conversation and visually. I think both. We should.
Visually, very difficult. Very difficult to do it visually. Conversation, again, I will just tell you what I do. I communicate with my patients just like I communicate with the dentists. I'm showing clinical cases. I'm showing videos, the details. I'm showing what my lab is doing. And then this is how I demonstrate the expertise of my team. And of course, a lot depends on the communication. A lot. Cases are cases, but the way how you communicate, how you feel the person in front of you.
Yes.
Sometimes maybe you feel you don't need to treat the person. Because again, you remember, as we discussed previously, you learn everything on your mistakes.
Yes.
And now I can tell from my perspective, for sure, sometimes it's better to say, your case is too difficult, I cannot help.
Yeah, that's true.
Rather than to start and then regret that you started communicating with the patient. Because when you speak about the interdisciplinary approach, it's a long run.
Yeah.
I mean, it can be 2 years, can be 3 years. Yeah. So basically the person becomes like the part of your family at work.
Yeah.
Okay. And definitely you don't want to have negative people in your family.
That's true.
So for me, the consulting is also filtering negative people and keeping only the positive people. And that's why, again, demonstration of the cases, live communication. This is where you can convince people. This is one of your main tools, especially at the beginning. After, if you were doing a great job for many years,
people just
come to you. They just come to you and you don't need to convince them with the mock-up. But at the beginning, of course, you need to do a mock-up. I remember I was doing mock-ups at the beginning for free, just to convince the person. So then they could pay for a case and we could, get money back for a mock-up as well. But again, there are stages of your professional growth. At the beginning, you do stuff for free. In the end, you don't need to do stuff for free because you're not selling your services. Somebody else sells you and your services for these patients.
Yeah, that's true. That's true. I think to the public, it is extremely important, the first visit to the dentist, that they kind of feel the difference. Yeah.
I can tell you that I'm planning to do a lecture, The Art of First Consulting. And I think that lecture is going to have a huge request because this is something that is not described, not in the books, not in the articles. And it's something that is super important because you can be an amazing dentist, but if you do not know how to communicate properly, it's like, how they say that many people can sing, but only few become singers.
Yeah, that's true. That's true. That's true. That's a very good one. You just have the best analogy every time. Thank you. All right. There's this trend now in the social media to say that because there's so much of bad dentistry done, obviously, veneers are bad for teeth. What do you think about that?
If they're done in a bad way, they're bad for teeth. For sure. It's better not to do any veneers rather than to do bad veneers. So this is why one mistake that often that I see the patients can do when they do the case the first time, they think, okay, this is so simple because my teeth are fine. I mean, there are no complications. I don't need to pay a lot to somebody who makes it expensive. I will just go to somebody who makes it cheap. But then they need to pay a lot to redo the stuff that was done for cheap. And then they end up with somebody who makes it more expensive, because they realize that expertise is important. So that's the point. So does everybody need veneers? For sure, no. For sure, no. Again, everything starts with the conversation with the patient. And first, what we do, we don't talk, we listen. Because we have to understand what is the request of the person. And then we think, can we help or we cannot help? Maybe we need to slightly change the direction of thoughts of our patient to explain that, you are almost right, but the better decision is this one. Like for example, okay, veneers are great. We can do them for you, but I think it will be better in your case maybe in 10 years. And for
that's a very honest answer, you know? Yeah.
By the way, you said a very correct word because I think that honesty is the most important thing when you communicate with a patient.
Yes.
For example, like, you know, some people like to promise, okay, we're going to do for your case, it's going to last forever.
No.
And what I do, even if they don't ask me, I'm telling them, you have to know that nothing lasts forever. I mean, even your natural teeth do not last forever. So the ceramic ones are not going to last as well. So you have to realize this. And when people feel that you're honest, I mean, they will stay in your office. I remember once I had a patient who came to my office because she said that in another office, doctors promised her that things going to work forever. And she's like, nothing works forever. So when I heard that phrase, it kind of scared me from that office. So they were trying to use it as a marketing tool to keep the patient in the office. And it worked completely opposite.
Yeah. Yeah. That's a very good point because it's true. I mean, the funny thing in dentistry is we are all trying to reverse time or help them. If there was no need for dentistry, there was nothing wrong with their teeth, we didn't need to fix it. But because things were going down south, that's why we needed to fix it. So if we fix it, that it can't be just one thing, and it can't, you know, there are other reasons why it failed.
And if veneers were bad, I wouldn't do veneers for my wife.
Yeah. Yes, your wife has got beautiful, beautiful smiles. So, yeah. I've seen her throughout the whole process.
She is often traveling with me, and a lot of dentists they
start showing.
And then I'm telling those are veneers. Are you serious? I'm like, I'll tell you more. Those are digitally done veneers with monolithic and 3D staining. Like, no joke.
Yes, they look so real and so individual. You know, it's amazing. All right. AI is beginning to get into our world. All right. So I'm just going to finish off with the future. Do you think AI will play a big part in what we do coming the next 5-10 years? I'm quite sure it is, but where do you think it will come in?
I can tell you it already is. I'm already using AI a lot for diagnostics, for example, for the CBCT diagnostics, because AI is not missing things. A human being can miss things. I mean, like if you need to check 5 CBCTs, then it's the end of the day. I mean, of course, you can miss some stuff. Yeah. And AI, it's very stable. Plus now, with a 3Shape new software, you do a diagnostic scan, one scan, and it provides you right away information about the occlusal caries, interproximal caries, plug, right away. So you don't need to do any stains to show to the patient. Then recessions.
Yes, that
right
one I've
away.
seen. It's so cool.
And automatically measures all the information. So you do one scan. And where also. The reduction. So where it shows right away where you already reduced to the level of the denting or just enamel. So you can show it right away to the patient. 1 minute scan, and you have all the data. And then you say, okay, it's not me, it's AI who is showing you that this is, you know. So it convinces additionally the patient that they have issues and they have problems. So, I mean, it's going to come to our life more and more. I'm not saying it's going to completely substitute us. Maybe someday in the future, who knows? But again, as I said previously, smart people will use it more to become smarter.
That's true.
And lazy people will not use it. And the gap will increase even more between them.
And I think we all need to make choices as to what you want to become and where you want to be as well. And no point talking about it.
I will tell you that even from the perspective of interest in life, it's cool to start using new stuff, even from this perspective, because like we're dentists, we're doing same thing from day to day, years after years. So even for ourselves to start doing something new, it refreshes our profession for us.
That's true.
I'm not even speaking about, bringing higher level of quality to the patients, bringing more comfort to the patient, bringing more comfort to us, to the team, making clinic even the high level.
That's true. That's true. You have one of the most beautiful clinics. I've heard. I've never visited, but I was told the protocol is so well set out and the layout is so well. I mean, did you work on this yourself, or you just came out with it?
Oh, that's another story, because when we were building the clinic, we were building the clinic from the perspective of the patient experience. So not just because, okay, this is the space and I want to put as many dental chairs as possible. No. We were imagining, okay, this is how patient enters. This is where patient sits the first 5 minutes or 10 minutes, because the patient has to watch the television. And on television, we're showing our clinical cases. So basically, then the patient goes the next step to the photo video studio. And from the photo video studio, he goes to the dental chair and then goes back to the photo video studio to discuss what was documented. So like this. So around this, yes. Yeah. Because it's sometimes better to have less chairs.
That's true.
But the proper experience, and people remember this, because there are many clinics with the dental chairs.
Yeah.
But not many that leave this taste that people remember.
Yeah. Yeah. And I think that's one of the key critical success of how you're treating your patients and why your patients are also happy with what you do. Yeah.
Yeah, because, nowadays the market is very full of dentists. I mean, I have a dental office across the wall. So my dental office and dental office across the wall. So, I mean, it's crazy. There are so many dentists. So that's why we need to have, again, a clearer plan and a clearer strategy how to differentiate ourselves on the market. Otherwise, it will be only damping with the price.
Yeah.
For us, it's not a choice.
No, it's not. It's not. But I've been so blessed to have met you, because you really inspire me. And whenever I'm down, I start thinking about you, because I say, under the conditions that you have done so well. Who are we to complain? Who are we?
You know how they say that difficult times create strong leaders.
Yes, that's true. That's true.
That's right now is difficult times.
Yeah, very, very, very difficult times. Actually, for the whole industry. But thank you so much again for sharing. And despite you being so busy, immediately doing this with us before your course starts tomorrow. Pleasure. And this is something small for you. All right. We named it. He is called Dental Optimist, right? And make every day a little more joyful. When we came out with this, and this is not a toy, by the way, I never knew that this guy in 1962 or so, he came out, it's a Danish design that came out with this, and all he wanted to do was to make everybody happy. And I hope Maxim is going to love playing with this.
Thank you so much.
And this will remind you that you've been here and there is hope, and that you brought a lot of joy to a lot of dentists today.
So I just want to thank you again for the invitation. I wish luck with your podcast.
Thank you.
Because I think that the topics that you raise, those are very important topics. Those are topics who are not just pushing people to do something. Those are topics that are educating people to do something, because it's not you or me who have to make decisions for other people.
Yes.
It's them who have to take the responsibility and change their professional life. And our job is to share our knowledge with them. And we will do it the best possible way. Thank you so much.
You're probably going to be the first one to make me cry. It's
honest.
Yeah, but it is true. I mean, it's really not about you or me. It's really about doing good in this industry. And I think you've gone through way more things than what any human being should ever need to go through, and to still stay focused. That's one thing that I kept asking you before. How do you even stay focused to work, and still do your best? And you're not just doing work, you are doing high level work and still maintain the standards and still chase and maintain and do the best for the patients. Most of the time people would just, I don't care anymore, Yeah.
Again, it's a choice.
Yeah, again, it's a choice. I wish there are more of you, and I really hope that for those who are listening, you're going to be so inspired with Dr. Nazariy. He really worked through all the difficulties that you can never imagine. Yeah, to be where he is today as well. All right. Yeah, I wish you all the best. Times. Yes, we wish for better times. I just hope you stay safe. Your clinic and your family and everyone back home is going to be safe. And trust me, there's one story. I literally offered him to even migrate. I'm quite sure everybody around the world offered you to migrate, and all your good friends were also talking to you, and you've introduced a lot of good people to me as well. And they were all saying, Dr. Nazariy, you need to migrate and get somewhere safe. And yet for you was the fact that you've built this empire back in Keith, where you practice the best dentistry and there are patients who need you there, and you still go back and do the best, for them. And that is putting yourself at risk, putting your family at risk. I mean, every day you have to make that kind of decisions, and I don't think anybody realized that. So any of us that complain, we have nothing to complain of how lucky we are.
We were just sharing that there are different periods of life, and now we're going through this period, but black and white lines, they change. But what we can do for you, we can share our knowledge and what we know. So we want to wish you luck, and thank you for being with us, and you're always welcome to Envision Asia. Thank you.
Thank you.